think, America's #1 most trusted brand, literally it is, has boldly entered into creating meaningful and impactful digital healthcare solutions. I don't want to say much more, as you just need to experience what they have done. So let's welcome Time Inc.'s team and their partners from Framestore and Stanford to the stage to share the powers of Lumen, which you will all be able to experience after our last keynote in the back of the room as well. So let's welcome to the stage.
I think we're going to wait till she calls us on, no?
Me okay? Yeah? Good? Okay, good stuff. I'm Heidi Anderson. I lead the healthcare industry vertical at Time Inc., which has been in place for just about 2 years now. And we really recognize at Time Inc. that health and wellness is an important factor in how consumers live and measure their lives. And we've really made investments over the last 2 years to create this vertical dedicated to healthcare, which really leverages the trusted voices of our iconic brands like Time and People and Health to make connections with health-conscious consumers like never before. We've started with trusted edit brands like Time and Health and Cooking Light, and we've added some new editorial franchises like Time Health and soon to come People Health, which you guys will all be seeing next month, to really elevate health and wellness in some of our core brands. In addition to that, we've expanded our footprint at the point of care to provide condition-specific content to empower patients. And today, I'm really excited, thrilled to turn it over to 3 mindful mavens to demo Lumen 2.0. And this is really an example of how we have leveraged our trusted brand Life in the VR space to help improve clinical outcomes. So please join me in welcoming Mia Trams, Managing Editor of Life VR at Time Inc. Come on up, guys. Guillaume Raffi, Executive Producer at Framestore, and Dr. Walter Greenleaf, Distinguished Visiting Scholar at the Stanford Human Interaction Lab. Thank you all. Hello. How's everybody doing? Good? Great. We'll just do brief introductions. My name is Mia Trams. I'm the managing editor of Life VR, which is Time Inc.'s company-wide virtual reality and now augmented reality initiative. I work across brands developing and producing VR and AR for all of our titles. And this was a very special project that was one of the very first I produced when we launched about 1.5 years ago.
My name is Guillaume Raffi. I'm the executive producer at Framestore Los Angeles office. We're a creative studio. We're doing all kinds of content, visual effects for feature films and commercials, VR and AR, and just about every flavor of the week as well.
And I'm Walter Greenleaf. I'm a neuroscientist by training, but also a medical product developer. I'm particularly excited to be here since I first got involved in digital health and virtual reality technology almost 30 years ago. So it's really exciting to see, especially to partner with a group like Time and Framestore, the technology finally make the transition from a research lab out into commercial and consumer use.
Walter has amazing experience in VR, as maybe some people know. It's been around for quite a long time. It's just like recent, and it's, he's as legit as they come.
Oh, thanks. Well, one of the things I'm really excited about is to see that this technology, digital health technology and interactive VR technology, AR technology also, is impacting the full stack of medical applications, starting with preventive medicine, health and wellness. VR can be used to help change behavior, modify behavior, inspire people to adhere to programs, but also tremendous value in facilitating training, not just training of how to do a procedure, but training on how to work as a team, how to have interpatient interactions, how to have empathy for the patients that you're taking care of. And of course, cognitive assessments are going to be revolutionized, and physical assessments are going to be revolutionized by the enabling technology that VR and AR technology gives us, both in terms of creating a standardized assessment environment, objectively measurement, and also capturing behavior, movement, and behavior in a virtual environment. And then there's a huge list of interventions that we have spanning all of healthcare, in behavioral healthcare, addictions, autism and Asperger's, helping with stress, depression, anxiety, post-traumatic stress, phobias, but then moving over to some more serious indications like psychosis. So we've seen what can be done in the research lab, and now it's transitioning out into the consumer arena. So I'm very excited, and we'll give you an example of how Lumen's been used for a very exciting program at the Stanford Children's Hospital.
So in our designing Lumen, Mia approached Framestore and for us to collaborate, and she came with a lot of great ideas.
Thank you.
And some really great references, and that certainly struck our creative chord. We actually had developed something that's called an L system, which is an algorithm to build trees, and so we're excited to put this algorithm in play for this project, given that she was keen on using the tree and nature metaphor for the project. We also used this component of VR which always appeals to the lizard brain, and using the savanna metaphors. In a savanna, a human feels very safe because all the vegetation is low. There's very little places where someone can feel danger coming from that place. So we certainly use this. We also, Aaron Jartarsson, our executive creative director who's from Iceland, instilled us to use this Icelandic palette using the Aurora Borealis to act as a UX to change and interact with the color palette, and you know, using color theory and relaxation through color as well. And certainly getting great input from Walter in this regard. And then the application is gaze-based to make it very easy and also very easy for people to grasp, but also very easy to port to different platforms. For our cursor, we use the Metatron. Metatron is the basis of the tree of life. We try to get some California New Age into every of our products. So that was our small contribution in this regard.
Beautiful contribution.
It was beautiful. And then, and then had all kinds of interactions, which you guys will be able to see a little bit later during the demo.
Yeah, and Time Inc. brands are certainly known for delivering entertainment and news, but something that we've done historically is also deliver tools for our readers to live a better life. So the concept with Lumen was to create an experience that would relax you in a matter of minutes. And to do that, we worked very closely with Walter and with the Framestore team to create an environment that really soothes you, that is customizable, which you'll see in the demo, and that gets you kind of focused and putting your intention and slowing your breathing down into a diaphragmatic breath.
With the VO. The VO was very keen on making sure the UX is very easy to grasp for anybody and very instrumental in getting this heart rate down.
We'll show you one of our use cases, but we don't have to remind this audience the value of teaching mindfulness and relaxation skills for all aspects of healthcare. So let me tell you about Project Braveheart. We worked with the Stanford Children's Hospital Cardiology Department. For children who are scheduled for a cardiac procedure, we know weeks, sometimes months in advance, what the worst day of their life is going to be, and so do they, and they dread it. So we decided to address that problem by capturing 360 video of the patient journey, starting in the parking lot, going to the registration desk, to the prep room, to the operating room, to the recovery room. And we overlaid it with green screen and kids who'd had the procedure before, so they could serve as guides and say, don't worry, you can do it, I did it, here's what's going to happen here. It's very compelling, very engaging. But to teach them the relaxation skills they needed to manage the stress that was being introduced, we used Lumen. And it was very effective. We are still in the process of collecting data. We've done a double-blind crossover trial, and we're collecting objective measurements of stress, such as cortisol, but also subjective measurements of stress. But I can tell you right now, even though we haven't blinded all the results, that we know that many of the kids who were otherwise unwilling to even show up for the procedure and go through the procedure have, after going through the virtual reality experience, said, yes, I'm ready to do it. So we've already made a big difference in several children's lives.
We were very lucky to meet Walter in the process of developing this. Originally, it was a program that was made for consumers, for our readers and our audiences. And it's been quite fortunate that we've gotten to integrate it into Project Braveheart and that it has found a really amazing medical application. The other great part about Lumen, if you are interested in using VR towards healthcare, is that it's built in a game engine. So instead of being pre-rendered 360 video that once you shoot it, you can't change it, Lumen is more like a video game. So as we've gotten feedback from Project Braveheart, we've been able to update it and really customize it and make it a very effective tool for the purpose it's being used for. So you'll be able to see some of the updates that we did today.
Yeah, I mean, to adapt it to kids, we changed the height, of course, in VR. It's always very important to make sure it's very relevant to the user. We adapted the color palette to something that's way more kid-friendly, I would say. We also did a very interesting port with FOV, which is a headset that can track your pupil. And that's a very interesting input for the system. You can do, you can actually direct the gaze much faster using pupils. And it gets a little used to, but once you're really comfortable with it, it makes it for a much better experience. And just all around made it, easier for kids to interact with.
Okay. I feel like we should just get into the demo,
Yes,
yeah?
yes, time
is running out. So what you'll see today is Lumen 2.0. It has yet to be released to the public. This will be forthcoming later this year. And I'll just talk you through some of the things that you're seeing and hearing.
And the concept of stress inoculation that we used for the children who were awaiting the cardiac procedure can be applied to all aspects of pre-procedure anxiety and preparing people for a difficult procedure.
Into an enchanted world that will calm and soothe your body and mind. To begin your journey, take a deep breath. Focus on the glowing light in front of you. This is your lumen. Notice how it expands and contracts like a breath. As it grows, take a deep breath into your belly. As it shrinks, breathe out. Good. When we are worried or stressed, we tend to have shallow breaths that are from our chest. When we take deeper, slower breaths, we have the ability to change and calm our bodies. Breathe in. Breathe out. Good. You're doing it exactly right. Now, stay focused on your lumen. We've entered into an enchanted world. There are surprises here waiting for you. As you gaze around, notice how your lumen follows your eyes. Do you see the glowing seedling on the ground in front of you? Focus your lumen on it and take a deep breath. See how your lumen and intention make it grow. How tall can you make it go? Focus on a branch to make it grow faster. You're doing a wonderful job. Your focus and intention are inspiring the forest around you to come to life. Do you see those glowing buds growing on the branches of your tree? Focus your lumen on them to make them blossom and drop more magical seeds. Go ahead and focus your gaze on the glowing seedlings in the grass. With your focus and intention, more trees will grow and bring the forest to life around you. Focus your gaze for a few seconds anywhere in the sky above. colors of the forest change around you? Find the colors that are most soothing for you. You can look around the sky for a few seconds at any time to change the color of the forest. Find the colors that are most soothing for you. If you gaze at the sky longer, you can change the time of day. Relax under the night sky or bask in the day. Now look around the forest. Do you see a set of large stones in the distance? Focus your gaze on one. Notice how your perspective changes. Focus your gaze on another stone and notice your height changes again.
Are you feeling more relaxed, Mia?
Very relaxed. So that's Lumen. You can see that there's a few features in there that really help to create a custom experience for the user. One of them that we added as a result of our work with Walter in this 2.0 version is your height. So you can see at the end there, I can change my height, and you can make it appropriate to what your actual height is, or if you like to be taller or smaller, it's up to you. You can also change the color palette of the world that you're in. The version we showed you right now was the daytime version. We have a nighttime version as well. So, really taking into account that across different cultures and different ages and different personal preferences, different environments might feel more or less soothing to a patient.
So this is the beginning. It's a pilot study, but I think what's significant here is that it's a collaboration of a company like Time with a group like Framestore and their creative vision, and coming to address a very important clinical problem, which is anxiety, and who knows where else we'll go from there. But it's a great example, I think, of the next generation of how digital health is starting to transition from being something that we talk about and say it'll be here one day. I'm looking forward to the time where we don't say digital medicine, we just say medicine.
Excellent.
Yeah.
Well, thank you all so much.